Well, tell us about what you teach.
So currently I'm a registered dental hygienist, and I teach about the effects of a raw vegan diet on the mouth. There's a lot of different factors, including a lot of erosion, which is caused by the acidity of all the fruits. Also, improper home care can exacerbate these erosion conditions. So what I recommend for my patients to do, and what for everyone else to do, is try to condense your acidic eating into small sessions and not frequent. So I'm saying if you're going to have orange juice, don't have orange juice 3 times a day. I want you to drink it all at once. This way that acid attack that happens to your teeth can happen all at once, because every time we eat, it drops our saliva to a very acidic level, and that's when the erosion occurs, and that's also when cavity occurs. So if we're doing a lot of snacking with a lot of high sugary foods or very acidic, we're going to do some damage to our teeth. So I recommend also rinsing with a lot of water right after you eat. I do not recommend brushing right after. I recommend to wait at least a half hour, because it's the new saliva in your mouth is going to buffer it back to a more neutral level. So I always recommend to chew some gum as well, maybe some spray with xylitol. This way you stimulate some new saliva to buffer the old out. I also recommend brushing 2 minutes twice a day and flossing at night. And you don't want to scrub your teeth. You want to be scrubbing like this. You want a nice and gentle 45-degree angle at the gum line. The technique I recommend is called the modified Bass. So you can look that up on YouTube. Just a nice massage in your gums. So good home care is super important. Lots of water. If you are so into acidic food, I want you to maybe have one day just alkaline and one day acidic. And the thing is, you may think just because it's alkaline for my body doesn't really have to do with your mouth, okay? Because yes, it's alkaline for your body, but we want it in your mouth that's not so alkaline. So snacking on things like cucumbers and lettuce and avocados and stuff like that, because we want you to have pearly whites. And if you got some crazy stuff going on, some recession, some sensitivity, you definitely want to get that checked out. So that's it.
Thank you.
You're welcome. Good?
Yes.
Perfect.
Everybody shows enthusiasm.